Okay, so now we want to complete this topic of euthanasia, which is one of the practical cases in medical ethics. It's a very important topic within medical ethics, which is euthanasia. Now, what does the term mean and why is it so important? That's what we're going to study. And we will study the application of the moral values or the principles, the basic principles of medical ethics when we study euthanasia. If you remember in the first uh, class, when we studied Introduction to Medical Ethics, we did four basic principles or moral values that are used within medical ethics or bioethics. And those four were: number one, autonomy; number two was beneficence, to do good, to bring benefit. Autonomy is recognizing कि patient एक खुद मुख्तार, एक free individual है, to recognize that the patient is completely free and can make decisions on his or her own self. Number two was beneficence. That means medical practice and all science should bring benefit. Number three was non-maleficence, which is that medical practice or any healthcare practice or any science practice should not bring any harm, non-maleficence, to bring no harm. And number four was justice. So we're going to see all these four being used in different ways. And one of the applications is euthanasia. We're going to study euthanasia today. So the term euthanasia is derived from the Greek euthanatos. This is the word euthanatos that means good or easy death. So easily you can see this has something to do with death. So it is an act to terminate a person's life who suffers from an incurable or extremely painful disease without the possibility of alleviation. So this is basically, we've seen it sometimes in movies, they show this. Many a times we hear of people in our circles who go through this, experience where they are terminally ill, so extremely critically ill. So somebody on their deathbed or something like that, or suffering from a very dangerous, very, sort of incurable disease, and or maybe an extremely painful disease, and the doctors say that there is no way they can treat this, or there's no way they can remove this pain. And in that case, this question of euthanasia comes in. We're going to see how. So basically, it's the act to terminate a person's life, either with their consent or without their consent, either by removing the life support or giving them something which will give them an easy death. So there are two types of euthanasia. Number one is active euthanasia, and number two is passive euthanasia. So active euthanasia is an act to take the patient's life deliberately or voluntarily through medical assistance. So active euthanasia is what? When you take a person's life. Let me highlight this. Yeah, active and passive. Active euthanasia is an act to take a patient's life deliberately or voluntarily through medical assistance. So basically, you would have a patient who is in an extremely painful state, and there's no way to take that pain away, and there's no way to cure that patient out of this pain. So in that case, or maybe somebody is in a complete vegetative state, जैसे हम देखते हैं, बहुत बार देखा है, बहुत सारे लोग, they go into coma for many years, 10, 20 years. There are patients abhi bhi, who are in a state of complete coma. And you have usme, one of the questions that is asked in medical ethics is that if it would be correct, फॉर एग्जाम्पल, अभी हम वो परमिशंस के बारे में जो है, ऑटोनॉमी के बारे में, वो तो बाद में आएगा. अभी फिलहाल देयर टू टाइप्स ऑफ यूथनेशिया दैट वी कैन स्टडी. वन इज टू टेक द पेशेंट्स लाइफ deliberately. So the patient is in an incurable, going through an incurable or painful disease, and you take the patient's life deliberately. Basically, this is a case, let's say the patient is in extreme pain, and the patient wants you to basically end this pain. There's no way, this pain can be cured or anything. So the patient says, you know what, I'm going to sign this document. I want to get rid of this pain and I want an easy death. उस वक्त क्या किया जाता है? उस वक्त the doctors go, take this thing. They go along with active euthanasia. They deliberately take the patient's life, obviously with the consent. That's why it's ethical, and this is done to basically give the patient an easy death. This is active euthanasia, right? Many a times they would give, basically they would administer maybe a dose of some lethal medicine, and that would basically end the patient's life who was in extreme pain or suffering from an incurable disease, or maybe in a state of absolute coma, complete vegetative state. वो तो एक्टिव यूथनेशिया हुआ वो. मगर पैसिव क्या है? पैसिव है यूथनेशिया is not an act to take the patient's life with medical assistance, but to withdraw all medical support of a patient and allow him or her to die. So this is the passive state. So you have a patient who is completely in a vegetative state, complete coma में. ना बात, ना चलना, ना हिलना, ना आंखें खोलना, ना कुछ. Complete coma में. So in that case, the question comes कि would it be मतलब ethical to basically, maybe the family members, because up to your patient cannot take the decision. Then the family members are of the opinion, let's say, after a year, 2 years, 5 years, 10 years, even 25 years, the long, very long cases of people being in coma for 40 years, I think even more. So in that case, maybe the family comes up and says, you know what, there's no sign of improvement. There's nothing. There's no future for this patient. So we would want you to basically, terminate their life and give them an easy death. So in that case, that would be called passive euthanasia, to withdraw all medical support of a patient and allow him or her to die. So obviously इसमें ये समझना जरूरी है क्या होता है medical support, in the sense that person is on life support. So basically by means of machines and equipment, we can basically assist the respiration. जो lungs हैं human being की, उनको we can keep them alive. We can keep the vital organs alive just by क्योंकि we know that oxygen से होता है. It's a completely different debate then कि whether this person is actually alive or not. Whether this person is actually alive or not, like the way we understand what life is. But medical terms में, just because the organs are functioning, because we are giving it the vital support, चाहे वो oxygen है, चाहे वो glucose है, चल रहा है body में, तो उस वक्त, but the patient is in a complete vegetative state, the question then arises कि how long is the patient going to be in the state? What if the family decides कि we should have to remove the लाइफ सपोर्ट? उस वक्त जब अगर वो लाइफ सपोर्ट खत्म किया जाए, उसको पैसिव यूथनेशिया बोला जाएगा. मतलब हम वी लेट देम डाई. One is to give them, basically make it easy for them to die. That is active euthanasia. One is to let them die after taking the life support off. So obviously we can see there are ethical issues involved in it, and we're going to go into that. In the case of active euthanasia, a patient is provided all medical support to make him or her death as easy as possible. So they're going through a lot of pain and they want this pain to end. There's no way that you can treat the pain, and they want it to end. They ask for it. They have the decision over their life. So they say, okay, or we want you to terminate this pain. So you help them basically, go through this. Now, obviously, इसमें debate है, is it murder? Would it be considered murder? Or are we helping them commit suicide? Or is this ethical because we are taking the pain away from them? So yeah, ethical questions ये मेडिकल एथिक्स में पढ़े जाते हैं. On the other hand, passive euthanasia is about withdrawing all medical assistance of a patient and the consequences of it will be death. So वो आप passively कर रहे हैं या आप actively कर रहे हैं. For instance, in active euthanasia, a patient will be given an injection of overdose painkillers and the result of it will be the death of the patient. So, for example, active euthanasia may the patient is in complete pain, the patient is in complete paralysis, and the patient wants or decides that I want to end my life. Please give me an easy death. I'm going through hell, and because the patient has autonomy, then what the medical experts could do is inject the patient with something which is lethal, जो मौत को आसान करेगा, which is maybe painkillers or whatever. Now, passive euthanasia is to withdraw the oxygen support of a patient who keeps alive with the help of oxygen machine. Usually, it's the life support machine, जो कि respiration आसान करते हैं. You switch that off, and the patient then passes away. It is an act of omission or withdrawing the treatment. But the question is, which euthanasia is more immoral? Or is it moral or it's immoral? So that's the ethical question that we have to study. Now, obviously, religious or traditional people think that passive euthanasia is morally better than active euthanasia. So, for example, if we talk from our own traditional perspective, suicide is haram. It is, forbidden. So, active euthanasia, jo jabki when you are assisting them to die, that is almost assisting them to commit suicide. So that will not be accepted, even though इसमें अलग opinions भी हैं. A passive euthanasia would be considered morally right in many, so there are many debates in this, many opinions in this. अच्छा, now there are other three categories. अभी तो आपने active और passive किया, मगर अब जब मर्जी पेशेंट की मर्जी आएगी या डॉक्टर्स की ये आएगी, प्रैक्टिस आएगी, depending on that, there are three more categories. So apart from active and passive, there are three more categories of euthanasia. Number one is voluntary. Number two is non-voluntary. And number three is involuntary. So voluntary euthanasia involves the consent or wish of a patient to end his or her life. So voluntary euthanasia will be जब patient वहीं से कहेगा, भाई, I'm going through hell. I want an easy death. It's very painful. And the patient will agree to sign the documents and give them their consent. अपनी मर्जी, अपनी वो इजाजत देकर कि आप, you give me this dose and make death easy for me. So that will be voluntary euthanasia. The patient is voluntarily, खुद अपने से ये decision ले रहे हैं कि I want to go through an easy death. Please administer this for me. So that's voluntary euthanasia. And as we have studied in the first class, this is the patient's autonomy. The patient is completely free to choose, and the patient chooses that this is what they want. They want to end their life because their disease or their pain is incurable and unbearable. तो voluntary euthanasia वो होगा जब पेशेंट ही कहेगा और कंसेंट देगा, मतलब इजाजत देगा. Consent is ijazat, and the patient will tell the healthcare practitioners or the doctors, physicians to end their life. Number two is non-voluntary euthanasia. I hope you're writing all of this in your notes. Non-voluntary euthanasia is a kind of euthanasia in which a patient is not able to give his or her consent, such as when a person is in coma or is a baby or is mentally, a disturbed person, mentally challenged. So non-voluntary euthanasia will be the kind of euthanasia in which the patient is not able to give. मतलब उसमें consent की का सवाल ही नहीं है, क्योंकि या तो वो बेबी है, तो बेबी को तो पता है नहीं, बच्चे को पता नहीं है कि क्या करना है, क्या सही है, क्या मैं क्या करूं. तो many a times, unfortunate cases, we see children in a very, very sort of a painful state. Maybe they have a very incurable disease that involves a lot of pain, or in a state of coma, unfortunate cases like this. So in that case, euthanasia that is administered would be non-voluntary, because the patient's कंसेंट इज नॉट इन्वॉल्व. पेशेंट ने तो कहा ही नहीं है, पेशेंट तो कह ही नहीं सकता है कि ये मेरे साथ करो या नहीं करो, क्योंकि पेशेंट की तो मर्जी है ही नहीं. वो तो बच्चा है या कोमा में है. फॉर एग्जाम्पल, एक मूवी थी, व्हाट वाज दैट, या इफ यू रिमेम्बर, मुनाबाई, मुनाबाई एमबीबीएस, द सेकंड वन. उसमें द पेशेंट is in coma, the actual patient is in coma, and they also study this, what to do with the patient in such a case, what is the ethical thing to do. So the patient is in coma, the patient cannot give the permission or the consent what to do with their life. And what do you do in that case? अगर यूथनेशिया किया जाए, अगर पेशेंट को उस वक्त इजी डेथ दी जाए, तो उस वक्त उसको नॉन वॉलंटरी यूथनेशिया बोला जाएगा, क्योंकि पेशेंट की तो कंसेंट थी ही नहीं, बिकॉज पेशेंट दे ही नहीं सकता था कंसेंट. The patient could not give his or her consent because they were in a state of coma, or a mentally challenged, mentally disturbed person. So, for example, they do not have their mental capacities. Yeah. So in that case, they are in a state of pain, or they are in a state of coma, or they're in a state wherein the medical practitioners have to give them, have to administer euthanasia. उस वक्त क्या किया जाए? उस वक्त अगर यूथनेशिया किया जाए with these people that are mentally disabled, that would be considered non-voluntary, because the patient's consent has not been, there is no patient, there's no consent from the patient, because the patient cannot give the consent. एक हुआ voluntary जब patient दे रहा है consent अपनी अपनी मर्जी और अपना ये इजाजत दे रहा है कि मुझे मारो. दूसरा नॉन वॉलंटरी जिसमें पेशेंट दे ही नहीं सकता है. नॉन वॉलंटरी में पेशेंट अपनी कंसेंट, अपनी इजाजत दे ही नहीं सकता है, क्योंकि या तो वो बच्चा है, या तो कोमा में है, या तो मेंटली चैलेंज्ड है. मगर थर्ड काइंड ऑफ involuntary euthanasia is a kind of euthanasia in which a patient wants to live, but his or her life is terminated because of its worst situation. So involuntary euthanasia matlab the patient has not given consent, and the patient wants to live. The patient wants to live, but still their life is terminated because of its worst situation. Now this would be considered murder. This would be considered murder, obviously, because this is very, this is unethical. But this also, there's some countries, I think, that allow this. And it's actually very rare, this one. So involuntary euthanasia is that the patient wants to live. The patient has not given consent for for their life to be taken, but they are still given euthanasia. Their life is terminated opposite to their consent. उनकी मर्जी के खिलाफ उनको मौत दी जाती है, उन्हें मारा जाता है. So this is extremely debatable, and it is considered, the majority opinion is that this is murder, because the patient wants to live, but you're still administering euthanasia. This is extremely unethical. So in some cases where a patient cannot give his consent, then then what would we say? Is it murder, or is it a beneficial act to give an easy death to a patient? At what point could euthanasia be moral or immoral? The morality and immorality of euthanasia practice could be determined through various practices such as religion, cultural, moral values, law, and scientific perspectives. So these are just to understand what is moral and what is immoral. We have these different views of understanding what is moral and what is immoral. So there are different theories to understand what is moral and what is immoral. Usually, religious, communities take religion as their, ethics theories. as their, basically their view on what is right and what is wrong. So, using those different views, we can come to the conclusion which one is unethical, which one is murder, or which one is mercy. So let's see some cases. In some countries, it is legal, such as Netherlands. In other countries, it is illegal and immoral, such as United Kingdom. To Netherlands, may it is allowed euthanasia, but I don't know which all. Maybe we can check that on the internet, because there are three kinds of euthanasia. What all kinds of euthanasia are allowed? So, for example, this is also pretty debatable. कि आपके पास, for example, baby hai, and baby cannot give consent, and then would it be ethical? Or maybe they're in pain, maybe they're in extreme, आप समझे, coma. So would it be ethical to give them euthanasia, or would it be unethical? So this is a debatable question. So there are countries that allow it, there are countries that ban it. There are some important questions in which we should reflect upon the perspective of medical ethics. Firstly, is it morally right to terminate the life of a patient who is suffering from an unbearable pain or incurable disease without the patient's consent? तो मतलब ये, this idea of the patient's consent is so important in medical ethics. So this is extremely important. Would it be considered morally right to terminate a patient's life who, despite the fact that they are suffering from unbearable pain or an incurable disease, but would it be considered moral? Would it be considered immoral? Would it be considered murder? Or would it be considered mercy? Now, second, on what basis would it be justifiable? अच्छा, आपके basis क्या है to consider something moral and immoral? Is there any difference between killing someone and letting someone die? So letting someone die, हमने भी discuss किया, this is passive euthanasia, letting someone die. So the person is on life support and you remove that life support, so you let them die. So is it the same as killing someone? That is also a question in this field. Okay, is it morally right to decide one's death? तो क्या एक इंसान खुद भी ये ले सकता है डिसीजन अपने ऊपर, अपने लिए? So, but what about those who do not have the incurable and painful disease, but they want to end their life? तो फिर मतलब, how different is it from suicide, right? How different it is. So this is an ethical question, and it is discussed obviously in religious scriptures as well, and secular ethics. क्योंकि अभी तो हम we are studying medical ethics from a completely secular point of view, non-religious point of view, even though religious point is also important in it. Okay, the all these questions must be analyzed from the lens of ethical theories and four moral values of medical ethics, such as autonomy, beneficence, non-maleficence, and justice. So मतलब ये सब questions हम उन्हीं चार जो हमारे moral principles हैं उनके लेंस के थ्रू देखेंगे. Which one is ethical, which is non-ethical? So for example, beneficence, non-maleficence, justice, autonomy. ये जब चार हम देखेंगे, we can understand which one is euthanasia, which one is ethical euthanasia, which one is unethical euthanasia. That is an important question, and obviously it will depend on particular cases. हम ऐसे generally तो नहीं बोल सकते हैं, particular case पे depend होगा. वो particular case, वो patient, how much unbearable is it for that patient, or how long have they been in coma, or how difficult has it been for them, or which state are they or their family members in. So बहुत सारे इसमें factors हैं. ठीक, so we're done with this. I'll just take you through this as well. This is the book I shared in the group, so you can go through that. This is a very important book on the subject. So when killing is no different morally than allowing to die. So allowing to die is passive euthanasia. Killing is active euthanasia. It is a form of killing. वो दूसरी बात है, ethical है या नहीं ethical है, मगर you are giving some some substance to a person to end their pain, and that is active euthanasia. So इसमें, so it would be absurd. Let's go. Wait, should we read this one as well? Oh, wait. So, is killing in itself no different morally than allowing to die? Can now be addressed. To assert, as we do, that killing is no different morally than allowing to die is simply to say that correct labeling of an act as killing or as letting die does nothing to determine if one form of action is better or worse or more or less justified. So basically, they are arguing, are they the same? Are they the same when you're doing this? When you is this the same as this? And इसका क्या मतलब moral value क्या है? क्या ये सही होगा? क्या ये गलत होगा? So all of this is discussion is here. I'll send it to you. You can read it. Let me read important points from this. Let me read this. So, nothing about either killing or allowing to die entails judgments about actual wrongness or rightness, or about the beneficence or non maleficence of the action. Rightness and wrongness depend on the merit of the justification underlying the action, not on the type of action it is. So basically, they're saying it's not really about the debate of whether it's the same or is it different. हमें देखना है इससे क्या हो रहा है. इससे हम, are we benefiting the patient or are we harming the patient? That's the point. It's not about what one is doing. That's one way to look at it. It would be absurd to accept all cases of letting die as morally justified, and it is no less absurd to view all forms of killing, for example, killing in self-defense, as unjustified. So basically, ये जो idea है, ये जो debate है, is it the same? Is killing, is euthanasia almost like killing, or is letting to die like killing, like murder? What is being argued is that हम नहीं कह सकते हैं कि all forms of killing are wrong, because it could be killing, for example, in self defense. अगर law में पढ़ा जाता है, self defense is not considered, or to save somebody else is not considered murder, right? So, or for example, letting to die, like we said, in a case like you want to relieve the person, you have the full consent of the patient. A judgment that an act of either killing or letting die is justified or unjustified entails that something else be known about the act besides these characteristics. मतलब इस तरह सिर्फ नहीं हम decide कर सकते. We have to know more about the situation. Like I said, there's so many other factors. क्या patient सच में वो चाहता है ये या चाहती है ये, या उनकी condition actually इतनी गलत है. So we need to know something about the actor's motive, whether it is benevolent or malicious, for example, the patient's request and the consequences of the act. So सारे angles देखकर, सब एंगल देखकर तभी इंसान जजमेंट बना सकता है क्या ये morally correct है या morally या ethically wrong है. Obviously, it's a very difficult subject, for the person who actually has to take the decision. Or anything else that we need to go through? Nothing much, actually. I can go through this, give you some arguments. So, but just the important things to note is the definition of euthanasia. Number two is the types of euthanasia, active and passive. And then the other categories, which is voluntary, involuntary, non-voluntary. Voluntary, involuntary, non-voluntary. So that's what's important. And then some discussion on what is ethical, how will it be considered ethical. The four principles, moral principles, have to be taken into consideration, जो हमने पहले ही पढ़े थे. And it's not a very easy, and it's not a very straightforward decision that could be made, in the sense many other factors that are dependent on the patient and dependent on the condition of the patient would have to be considered. So I suggest you go through this book as well. You get some opinions. There are some, real life examples also here. Okay, so we are almost done with euthanasia then. And obviously you'll have to write about where it's legal, like Netherlands may it's legal, and United Kingdom may it's illegal. Maybe an assignment for you, you can just find out on the internet India ki position kya hai on euthanasia. So you can find that whether it's legal here, which ones are legal, क्योंकि 5 categories हैं, और उनमें से कौन से legal है या illegal है, opinions क्या है. So you can do that, and that will enrich your answer. All right, then let's end this here. And now the only thing that's left is genetic engineering. Let's see when we complete that. Even though I want to cover another subject, जो कि आप medical ethics के introduction में, I think you will have to use that as well, which is the theories of ethics. So we've done the basic principles of the moral values related to medical ethics, the four moral values, but you will also have to write a short note on the theories of ethics related to medical ethics. So inshallah, we'll do that as well. I'll send you the notes for that as well. So take care. Let's end this here, and I will keep you updated.